Hello everyone, my name is Jeff Toretsky and I am the Division Chief of Pediatric Hematology and Oncology at MedStar Georgetown University Hospital. And I'm here to give you two messages over the holidays that I think are important to keep in mind as we all enjoy the holiday spirit and we all travel and we all visit other people. So the first message is that unfortunately, cancer doesn't stop for the holidays. It's really a very interesting phenomena that when people visit their young relatives, when grandparents, for example, visit their grandchildren, there's an opportunity for giving baths and extra hugs. And it turns out that it's very interesting that there's a small correlation between diagnosing new types of cancer in a child and a grandparent who might be bathing a child who hasn't seen that child for, say, 6 months. When we bathe our children every day, we're not used to seeing small changes that occur over time. Sometimes those changes are surprising to us when somebody points them out. So my message to you today is don't panic. If something like this happens, you want to get in touch with your doctor and follow up in a reasonable way, but just be aware that sometimes new eyes on your child might lead to some information that you weren't otherwise noticing. And keep in mind the warning signs of cancer and know that there's lots of people out there to help if you have this diagnosis. The second thing I want to talk about is many of you will be traveling and the other way around. Young kids will be visiting older people who might have immunocompromise from all sorts of things, just being very old or having cancer themselves, being treated with various medications that cause their immune systems not to work will make them more susceptible to the kind of diseases that children routinely have in terms of drippy noses, coughs, and so on in the winter. It's really important that we are aware when our children are sick and we're visiting others who could become ill from these common illnesses. So basically a few simple things. Number one, if your child is ill, let the person know that you're visiting them. Understand the state that they're in. Make sure we use good hand washing. If somebody's got a productive cough or a runny nose, it's probably better to avoid being near those people who are severely immunocompromised. And if all else fails, you can get a mask from the doctors who are taking care of the immunocompromised patients to help prevent the spread of some of these diseases. Once again, the best thing you can do is wash your hands and have a happy holiday season.